Before I go into my patient's room, I would check my chart, check my physician's order, make sure I have the right patient, make sure I'm doing the right tasks, make sure I have the right supplies, gather everything I need. And then I will also check the doses and the concentration. Then after I gather my supplies, I would check my formula, make sure it's in date, check the concentration, compare it to what my physician had, make sure I have enough, and also make sure it's room temperature. I will also need 2 graduated cylinders and a syringe. And then I will go into my patient's room, perform hand hygiene, put on clean gloves, and while my patient is still flat, I would listen to their bowel sounds, starting in the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. And then after I listen to their bowel sounds, I would just set them up into semi-Fowlers. And then I would check to make sure that their tube is in the right place. I would do that by checking the centimeters at the base of the nose, and then I would compare it to what's on my chart that the last nurse had. And I would also do that by checking the stomach contents. So I'm gonna just close off their tube, open it, open it up, just pull up just a little bit, close it off, set back up, and then I would check the pH of this. I would just put it on a litmus strip, or I could just put it in another container and stick the strip in there. And make sure that it is less than 5.5 to make sure that it is stomach contents. And before I can feed my patient, I'll have to check their residual to make sure there's not anything just sitting inside my patient's stomach. So I'll do that by grabbing my syringe, closing off my tube, open it. Now I'll pull up the stomach contents. I'll pull up until there's no more coming out. And while I'm checking residuals, it would have to be, if I pull out more than 250 milliliters, I'll have to come back in an hour and recheck it because I can't feed my patient then. But if it's less than 250, I would pump it back into the stomach. Also, if it's more than 250, I would pump it back in the stomach as well. I would pump that back into the stomach slowly. And since that was less than 250, I would be good to start feeding my patient. So I'll just take this off. I'll go ahead and open my formula after I've checked the date and the concentration. I've performed hand hygiene, put on clean gloves. Now I'm ready to start feeding. So I'll just close off my tube. Put my syringe. Now I would have my just let that go. Being careful not to let it drip out too fast. And then while that's draining, after I've finished my formula and all my formula is gone, I fed it all, I would just grab regular tap water and I would just flush the tube with 50 to 100 milliliters of just regular tap water after I'm done with the formula. So I'll let it get kind of low. I'll just flush it. I'll make sure that it's still some formula in there. That way I'm not giving my patient any air. I'm not putting any air into my patient's stomach. So then I'll just let the water flush through the tube. And then once it starts to get low, to prevent air from flowing in, I would just close it off while I still got a little bit of water in there. And just take that off. And while it's still closed, close it up and let the rest drain through the tube. And then once I'm done feeding my patient, I would leave them in semi-Fowlers for about an hour just to let that digest. Then before I leave the room, I would check, I would put my patient's bed all the way down, lock the wheels, make sure they're comfortable, and then I would document the time, the date. I would also check my patient's O2 stat to make sure it's normal. Document date, time, the procedure, how much food, what I did to make sure the tube was in the right place, and then I'm done. So when giving medication, before I go into my patient's room, I would check my chart, make sure I got the right patient. I'll also check my physician's order to make sure I pull the right medication and have the right dosage of medication, and make sure, check the route I'm giving the medication. So then I would grab my medicine. All I have is liquid, but if I had pills, before I crush them, I would check to see if they were enteric coated, or if they had sustained release on them. If they did, I wouldn't be able to crush those. I wouldn't be able to crush those kinds of medicine, so I would have to talk to my physician to see about maybe changing the medication or giving it a different route. And then I would just make sure I have all my supplies. So I would need just some regular tap water, a graduated cylinder, and a syringe. Then I got all that, I'm ready to go into my patient's room. I would wash my hands, put on clean gloves. I would ask my patient, verify my patient. My name is Harlan, I'm going to be your student nurse. If you could just tell me your name and your date of birth. Then I'll check that using their wristband. And then while my patient's still flat, I would just listen to their bowel sounds in the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. And then after that, I would sit my patient into my Fowlers, and I would check to make sure their tube is in the right place. I would do that by checking the centimeters on the tubing. At the tip of the nose, I would compare it to what the previous nurse got to make sure it's still in the same place, in the right place. And then I would also do that by checking the pH of the gastric juice. I would just close off my container, open it, pull up just a little bit, close it back off, put it down, and I would check the pH of this. I would put it on a litmus paper, and I would make sure the pH is less than 5.5 just to confirm that it is stomach contents and not anything else. Then also I would check the residuals before giving medication. So it says when administering medication, you only need to check 100 milliliters of the residuals. So I would just close it, put this in, pull up till it stops. If I get more than 100 milliliters, I would just come back in an hour and recheck it. If it's less than 100 milliliters, then I'm good to go. So I would just pump it slowly back into my patient's stomach. That's it. Since I got less than 100 milliliters, I'm good to give my patient their medication. So I've got my patients to my Fowlers, I've done hand hygiene, I've checked my medication. So first I'm just gonna flush my tube with 30 to 60 milliliters of water before. Just take this off. I would just flush my tube. Well, if I can. Just let that flow. Then before it got too low, I would just have my medicine ready. Just to prevent any air from going into my patient's stomach. And then after each medicine, I would flush the tube with 20 to 30 milliliters of water. And then after I'm done with all my medication, I've given every pill, every liquid, I would just flush it again with 20 to 30 milliliters of water. And just let that flow. Then before it got down to the end, I would just close it off to prevent any air from getting into my patient's stomach. And then after I've given all my medication, I would leave my patient sitting in semi-fowlers for about 30 minutes to an hour. Before I leave the room, I would put my patient's bed all the way down, make sure the wheels are locked, make sure my patient is comfortable, and then I would document the date, time, the route of the medication, how much medication, whether it was liquid or pill, and then I would just continue to check on my patient until I'm done. To set up the suction, before I go into my patient's room, I would check my chart, make sure I have the right patient. I would check my physician's order to make sure to see what rate he or she would want the suction to be set at. And then to just set up the suction itself, I would take the container, attach it to the holder on the wall, be sure to plug in all the tubing, connect all the tubing, and then after I got that set up, I would perform hand hygiene again, put on clean gloves. Then I would just verify the placement of my patient's tube. I would do that by checking the centimeters on the tube at the base of the nose. I would compare it to what the previous nurse got in my patient's chart. And then I would also do that by verifying that the tube is in the stomach by checking the pH of the stomach contents. I would connect this, pull up just a little, close it, and then I would just put this on a litmus strip just to check the pH and be sure that it is less than 5.5. That'll just confirm that the tube is inside of the stomach. So now that I've got that, and I've confirmed that my tube is in the stomach, I'm going to set up my patient's NG tube to the suction on the wall. So I'll just close off my tubing, open it, connect it to the tubing that's in the wall, and I can just open it up, make sure that it's secure at my patient's nose and also attached to my patient's gown. And then once I've got it set up, I will just observe the stomach contents that's coming out. I will look for the color, the consistency, and just the amount of contents that's coming out. And once I'm done, I'll just take off my gloves, perform hand hygiene, make sure my patient is comfortable, put the bed at the lowest setting, lock the wheel, put the call light in reach, and then I would just document the date, time, the color, the amount, and the consistency of the contents that came out, and also what rate I set my suction to.